What should you pack in your caesarean birth bag? Now, this is worth a watch and a say for anyone having a planned caesarean. So I wrote an article on Sales for Life a few years ago about what you should pack in your birthing bags. You can type in Angie midwife birth bag preparation. So things to pack into your suitcases or bags. I always recommend that you have a suitcase or a bag for mum and a suitcase or a bag for baby, and then another bag for things like food or for your birthing partner's change of clothes. The reason being, if you say to your partner, I need a maternity pad, I need a spare pair of pants, they can go into one suitcase. It also means that anything that you need for baby is much more easily findable too. So the must-haves are your maternity notes if they're not electronic. You need payment methods for parking, whether that's card or whether that's some cash, depending on where you're having a baby. Your birth preferences. So even in caesarean births, there are preferences for your caesarean. If you have a look in the caesarean birth series, we still want to know whether you want things like skin to skin, delayed core clamping, how you are planning on feeding your baby, whether you want vitamin K. Take a scroll through the caesarean birth series, there's loads of information there. Pyjamas, something that's going to make you feel really comfortable. With caesarean births, I recommend things like night dresses that are really loose to be able to help. You've also got to think you'll have a catheter for at least 12 hours. You don't want trousers in that time, and that's where a night dress can make you feel much more human, much more like yourself, and not put any pressure on that scar or that wound in dressing. Maternity bras and breast pads are really useful, and also thinking about a going home outfit for you. Think comfort. Things like leggings, things like your pregnancy clothing that has nice high waistbands up to here can be really comfortable to go home in. Avoid jeans and tight-fitting clothing. Again, this is where loose dresses can be really useful to go home in. Cotton pants or period pants help with preventing leaks, and cotton pants that are up to here as well, high-waisted, can be really useful. If you have really low-waisted ones, if you've got the dressing that's removed at sort of 24 hours after your caesarean birth, it can rub, it can make you feel really sore and uncomfortable. So think really high waistbanded, cotton, breathable pants or period pants. You'll also want maternity pads, and you'll be roughly changing them every 2 to 3 hours in those first few days. And if you think with a caesarean birth, you're looking at on average between a 1 and a 2 day stay, you're looking at around about 20 pads on average is what you're going to need. And these can be reusable pads. Maternity wards are very bright, they're also very noisy, so thinking about things like eye masks, headphones, compact speakers, anything that's going to help you feel far more relaxed to be able to get some sleep overnight. You need a wash bag with all the things that you're going to use when you get up and shower for the first time, so things like deodorant, shampoo, conditioner, body wash, towels, moisturisers, combs, brushes for example. You'll need your phone charger. If you are planning on breastfeeding, a breastfeeding pillow can be really useful. Pillows in the NHS are like gold dust, quite honestly. That will make it smell like your home environment and help you sleep better as well. A refillable water bottle can also be really useful as well to keep you hydrated, and it'll be easier for your birthing partner to be able to fill up to. A TENS machine can be fantastic for post-operative pain relief as well, and so TENS machines can be used to help women who've had a caesarean birth get out of bed for the first time. Chewing gum is a must-have. The moment you enter recovery after your caesarean birth, start chewing gum. It helps to reduce the chance of a paralytic ileus, which just means that your bowels stop working, which can cause severe pain, discomfort and readmission for mums. So chewing gum the moment you hit recovery really helps to get your bowels working again. Peppermint tea is a must-have on day 1 as well. Too much peppermint tea can lead to a reduction in your breast milk, but having 1 to 2 cups on day 1 really helps in moving that wind pain, that trapped air that happens post-caesarean birth. Less pain postnatally equals a better recovery. In many units now, they are also recommending that you take your own paracetamol and ibuprofen in. The reason being, you then self-regulate that far better sometimes than midwives on wards, because midwives on wards are sometimes one midwife to 10, 11, 12 women and 10, 11 or 12 babies as well. We know from the CQC reports that there are delays in women getting pain relief postnatally, and having your own paracetamol and ibuprofen to hand, if you can have these, can really help with that postnatal recovery. Please do discuss this with your own midwives though. Snacks, isotonic drinks and any dietary requirements that you might have, there will be amendments made for you, but sometimes these can take a couple of hours to get them up from the catering companies. And so sometimes it's easier if you've got some of these dietary requirements to hand, things like oat milk or soya milk for example, until it comes up. Some units also have microwaves in, so if your partner wants to take some meals, for example, some ready-made microwavable meals, they can do that as well. In terms of packing for baby, you're looking at about 5 outfits per day. Babies who are born via caesarean birth are often quite mucousy and quite often bring up a lot of that mucus in the first 24 hours. A blanket for going home is also really important, some hats for baby. Theatres get really cold, so we like to put hats on babies whilst you're in theatre to prevent them from getting cold. Nappies, you're looking at about 10 to 12 per day, either single use or reusable, and wipes again, either single use or reusable. You'll need some muslins, which will also help with that mucus and clearing it from their mouth when they bring that back up. You'll need either a car seat or a travel system to be able to go home in. You don't need to take that up with you for your caesarean birth, but when you are discharged and you are ready to go home, that's the time to bring it up to the unit. You'll also want to think about your antenatal hand express milk, which can help a baby getting some milk in those early days. Really great thing to do when you have a caesarean birth is to do some hand expressing in the antenatal period. And finally, some hospitals require mums to bring up their own formula or their own bottles to be able to make up feeds when you're there. It is worth having that conversation with your own community midwife to find out if your hospital provides formula or whether they ask you to bring your own in. And whilst there is no difference in the brands of first stage infant milk in terms of calorie and nutrient content, some hospitals will only provide one particular brand of formula milk. So if you have a specific one that you have in mind that you want to use, then take that in with you.